Next, we're going to go ahead and look at what the tabs do. You have your inbox communication tab, which is what you first see when you log into QCPR at the patient level. You have your inbox where you would sign off on your orders, your nurse communication, MD to RN treatment orders, which are also your freestanding orders, and your face sheet, which has multiple items of information that you would be able to access based on the documentation by the nurse or orders entered. The next tab over is your BCMA. You're able to view all of the patient's medications, and we will go in to chart those in the module for med charting. The Med IV Summary Edit Cancel Meds. This is the tab you would go into to make any changes to the orders that you document. It will allow you to either edit or cancel any medications if you charted that you gave it but the patient refused it at the last minute. And we'll come back to do that when we do BCMA. Correct time reverse cancel. This is where you would go to be able to change the time on an event, whether it be a med or a documentation screen. If you didn't put the right time when you documented an admission assessment or a shift assessment, you would be able to make any changes here in the event time correction. If you click on that, it's really easy to do. You would find the ones that have already been charted will be in blue. You're able to see this information here. I can see the ones that are not grayed out are the ones that are accessible. I can then go ahead and double click the item I want to put in a new time for, and it's going to ask me to put in the new date and time. Now if this is for today, you would be able to just enter a time and say OK and accept the new date and time. If this was for a different date, you would need to put in a different day. So for instance, if I want to change this one and put in a date for yesterday, I could do T-1 space 1600 and accept the new date and time. And that's all you have to do for those. Same thing with Med IV time correction. If I had any meds that I wanted to correct the time on, I could. I don't have any available, but it basically works in the same way. The event cancel reversal. If you cancel an event off of your work list and you want to bring it back because you want to go ahead and chart it, maybe you did it in error or you need it back for whatever reason, you would be able to bring it back and say, well, this was canceled or resolved in error, and accept. Once you do this, it will automatically bring it back to your work list at the original time it was ordered for. The same thing can be done for any medications. If you cancel a medication because the patient refused it initially, you would be able to bring it back by double clicking on the item and saying why you're bringing it back, and then file it. It will bring it back to your BCMA to be able to then chart it. The next tab is your active orders tab. This is just a list of all your active orders that are on the patient. It is by category, so I have medications, laboratory, radiology, nutrition, etc. So you would be able to view all that information in one place. It does give you some good information, all the instructions, any doses, routes, frequencies, all those display in the active orders. The next tab is your care planning tab. I don't have any care plans on this patient, but you would basically be able to see anything for the nursing care plans displayed. The flow sheet is where you would be able to view all the patient's vital signs, their blood sugars, their pain levels, their bowel movements, intake and output. If the patient's in the ICU, you would be able to see if they were collecting it, the hemodynamic vital signs, and event settings that were documented. This is where all the information from iSirona will go to live after it's been accepted in. These are by the hour. It will display the most recent on the right hand side of the screen. I don't have a whole lot of vital signs on this particular patient, but as we add more, it would move my screen to the right, so you would be able to see more data. You're also able to see if you work in OB, it has its own flow sheet. Basic same information. You have your vital signs listed. If they had any documentation for magnesium sulfate, you would be able to also view this at an hourly interval, so you would be able to see whether or not the patient is doing well or if they need an intervention. The next tab over is your RX history. You would be able to see, just like we looked at in the consolidated med list, you would be able to see any meds that the patient has filled at the pharmacy. Next tab is your graphs for temperature, respiration, and O2 sat. Next after that is your pulse and blood pressure. Problem list is the doctor's ICD-10 codes, and this is only for viewing. We don't interact with this in any way, but it is there for you to be able to view what the doctor has put in, because it might be different than the admission assessment, and you may want to be able to view what the doctor has put in for ICD-10 codes. Last tab is your growth chart. So you have your pediatric or infants, and as they come back for subsequent admissions, you're able to view that information displayed, whether or not they are meeting criteria on the growth charts as far as weight, height, length. And this would obviously only pertain to your pediatric type patients.